everyone, and it's a pleasure to welcome you to the PSHAN Periscope webinar series. This Periscope series is an engaging platform designed to shed light on critical issues within the health sector and explore potential solutions to the issues that we discussed today. And so to take us through the next 45 minutes, we have a panel of seasoned experts that will engage in this conversation, and we hope that the distinguished members of the audience will do us a favor as well to keep engaging with us through this time on our various social media platforms, even after the conversation has ended. So we make all of you feel very warmly welcome this morning by saying thank you to you for joining us right on time to kickstart the conversation. So thank you to everyone who is here, and we know that we will have an engaging time in the next 45 minutes. To kickstart this very engaging conversation, I'd like to welcome for her opening remarks, the MD CEO of the Private Sector Health Alliance of Nigeria, Dr. Tinuola Akimbolagbe. Over to you, Dr. Tinu.
Thank you, Dr. Anne. Good morning, everyone. It's my pleasure to welcome you to this edition of the PSHAN Periscope webinar series. This is a platform where we engage thought leaders, policymakers, and private sector stakeholders to discuss pressing health issues and explore collaborative solutions. Today, we're addressing a topic that has far-reaching consequences for public health in Nigeria: health misinformation. The spread of false or misleading health information is not a new challenge. However, with the rise of social media, social networks, digital media, and user-generated content, often with unverified sources, misinformation now spreads at an alarming rate, often faster than facts. We've seen the real-world consequences. During the COVID-19 pandemic, misinformation fueled vaccine hesitancy, and it delayed our national immunization efforts. Before that, false claims about polio vaccines also hindered eradication efforts in Nigeria for many years. So misinformation about diseases like HIV, AIDS, cancer, and even basic medical treatments continue to influence public behavior and often have dangerous outcomes. So the question we must answer today is, how do we collectively address this challenge? At the Private Sector Health Alliance of Nigeria, PSHAN, we recognize that combating misinformation requires a multi-stakeholder approach. Health professionals, media houses, policymakers, digital platforms, and influencers must work together to ensure that accurate, evidence-based health information reaches the public in a way that is accessible, engaging, and trustworthy. That's why today's discussion is so critical. We've assembled a panel of experts who will discuss the sources, the drivers, and the impact of health misinformation, as well as explore practical solutions that can help rebuild trust in health information sources. I encourage you all to participate actively, ask questions, and most importantly, take away insights from today's discussion back to your respective fields. Whether you're in the healthcare, media, policy, or advocacy sectors, you have a role to play in strengthening public health literacy and ensuring decisions on facts, not fear. So once again, I thank you all for being here, and I look forward to an insightful and impactful conversation. Thank you.
Thank you very much, Dr. Tinuola, for your welcome remarks. And we have, from the welcome remarks, heard that we all have a role to play in terms of managing misinformation in the health sector. And so this is a baton that has been passed on to all of us. To give us a goodwill message, I'd like to invite Dr. Wale Olusonya, who is the Managing Director of VCare Diagnostics Limited. Dr. Wale Olusonya is a consultant clinical microbiologist and project manager. He's adept at transforming strategic mandates into effective programming plans and driving innovative improvements. He successfully led a team in negotiating and establishing the largest public-private partnership diagnostic center between PPC Limited and the Lagos State government. Dr. Wale is driven by compassion and accountability and has a keen eye for details. So help me welcome to the microphone Dr. Wale Olusanya for his goodwill message. You can
Good
keep
morning,
the
everyone.
applause.
Good morning, everyone. So I want to welcome everyone to joining this PSHAN health webinar series. Today we're discussing a critical topic that's addressing health misinformation in Nigeria, the role of the media, influencers, operations, and educating the public. This subject is incredibly important, especially given the vast amount of information available to the public, particularly in healthcare. The COVID pandemic highlighted the challenges of misinformation and information overload, making our conversation even more relevant today. I would like to express, my gratitude to Dr. Chinua Kimbolade and her team for their exceptional efforts in running PSHAN and organizing this impactful seminar. I'm proud to say that there's no other group or alliance that is quite as collaborative and is as effective as PSHAN in Nigeria as of today. And to our panelists that we'll be speaking to, Mr. Shioni Bide, the CEO and founder of Budget IT. Thank you very much for coming. In fact,
It's a pleasure being here today. Thank you so much for the invitation.
I think I went off now, but I can continue. So I want to thank Mr. Onigbide for joining us. Mr. Kanem Iske, the Director of Programs and Advocacy Commission at Gates Foundation, for joining this important webinar series. Ms. Abimbola Adebakin, the founder and CEO of Atlantic Africa, we appreciate your presence, ma. And last but not the least, Dr. Anne Ada Ogo, the Director of Policy for PSHAN, facilitating this discussion. And I wish everyone a very fruitful deliberation. Thank you for your
Thank you so much, Dr. Wale Olusanya, for your goodwill message. And we thank you for being here. And before we go on to the panel conversation today, where we're going to be looking at addressing health information in Nigeria, the role of media, influencers, and health professionals in educating the public, I'd like to set the tone for the conversation. My name is Dr. Anna Dalgo, and I'm privileged to be moderating this distinguished panel of experts today. So globally, health misinformation has been identified as a significant public health threat. According to a study in 2021, nearly 59% of global health misinformation is spread via social media. And we all know how available social media is now to us, which was a trend we didn't have about 10 to 15 years ago. And this has led to harmful health behaviors, especially vaccine hesitancy. In Africa, this challenge is even more pronounced, with sub-Saharan Africa experiencing a 30% increase in vaccine misinformation between 2020 and 2023. This has fueled outbreaks of preventable diseases like measles and polio. Nigeria is the most populous country in Africa and also faces one of the highest burdens of misinformation-related health risks, from false cures for malaria to skepticism around routine immunization programs. Therefore, the impact of misinformation extends beyond just individual health decisions. It erodes trust in healthcare institutions and impedes the progress of critical public health initiatives. And so if we must reverse the poor indices that we see for health indicators in Nigeria, it is important that we address one of the root causes of why we have very poor health-seeking behaviors as Africans and as Nigerians in particular. And one of the ways to do this is to tackle health misinformation. And so with this as the tone for this conversation today, I would say we dive into this timely conversation as I try to introduce the distinguished members of this panel in no particular order. So to one of the panelists here with us today is Mr. Ikanem Isiche, who is the Deputy Director of Program Advocacy and Communication for the Gates Foundation. Mr. Isiche is in his new role as the Deputy Director for Program Advocacy and Communications for Nigeria, offers expert advisory services in various domains, including advocacy, public affairs, policy analysis, strategy, compliance, business performance, turnaround management, gap analysis, and political risk and project management across diverse sectors. Mr. Isiche is a seasoned professional, and his extensive portfolio encompasses oil, energy, social development, ICT, FMCG, and the health sector. Please make welcome Mr. Isiche. Please keep the applause coming. Also on this distinguished panel today, I have the pleasure of introducing Mr. Olusegun Onigbinde, who is the co-founder and the Chief Executive Officer of Budget IT. Mr. Olusegun Onigbinde is a prominent figure in Nigerian civic realm, co-founding the organization to bolster fiscal transparency and international institutional accountability. He was named a young global leader by the World Economic Forum in 2023, and he serves on various boards and advisory committees, including the Cost of Governance Reform Committee and One Africa Policy Advisory Board. Please welcome to this distinguished panel, Mr. Olusegun Onigbinde. And also, I'm privileged to introduce Mrs. Abimbola Adebakin, who is the founder CEO of Advantage Health Africa. Mrs. Adebakin is a certified program technologist. She's a pharmacist. She's a management consultant and technical innovator who drives performance improvement in African healthcare. She is the founder, Chief Executive Officer of Advantage Health Africa, enabling access to quality and affordable healthcare in Nigeria through market access and pharma distribution and leveraging technology and aggregation. She is a master trainer with the Institute of Directors, mentors for WIMBIZ and Google Startup, and serves as program director of the Pharmacist Leadership Stimulant Program, promoting career stability for young pharmacists. Please welcome to this distinguished panel, Ms. Abimbola Adebakin. To kickstart the conversation, let me come to Mr. Ekene Isiche, who is the Deputy Director of Program Advocacy and Communications at the Gates Foundation. So, Mr. Ekene, from your past and present roles, what key lessons have you learned about the impact of health misinformation in Nigeria? How has that affected us as a people in terms of how people access healthcare services and take responsibility for their health-seeking behavior?
Look, thank you. Great question, and thank you for having me. So over the past years, we've seen that health misinformation affects lives. There's a cost element to it, and it tends to cause a lot of disruptions, especially in the healthcare sector. And I'll answer this in the impact in 3 areas. I think the first impact you see is there's an impact on the availability of the health systems. So what that does is that it causes disruptions. And when I talk about disruptions, I'll talk about the fact, like during the COVID era and during the Ebola era, because of health misinformation, you found out that some primary healthcare centers were either really full or pretty much nobody was there because of health misinformation. So the other part too is that it also causes a disruption also around even the financing aspect. You find out that in most cases, governments will either deprioritize or prioritize based on health misinformation. But in most cases, it will deprioritize things. So that's why you find out sometimes there's a lower budget for the healthcare sector because it may not be seen as a priority because of misinformation. And you also find out sometimes that it also causes donor hesitancy in some cases, and donors would like to do a lot of things in those particular areas, but they can't because of, once again, health misinformation. So one of the things I'm really trying to hint on is the fact that there is a cost element to it. And even in some cases you have, because of health misinformation, it also causes some demoralization to some of the healthcare workers. It also causes, a bit of the fact that some healthcare workers, what do you call it, like I said, are demotivated in going to work. They may even be stigmatized in going to some places, all because of false information or fake news. So the key is that once there's a lot of fake news within a particular, area, sector, especially during emergency outbreaks, then you definitely see a lot of what do you call it, disruptions going on. So once again, it has an effect on the financing element in the healthcare system. It has an effect on the availability of what do you call it, essential healthcare services. It also has an effect on uptake. That's why you see a lot of times, sometimes people hesitate to take either vaccines and it causes disruptions in things around polio, and also things around even MNCH, just some basic things. So
thank you very much.
Stop there. Thank you.
Yeah, so thank you so much for providing that context in terms of the extent to which health misinformation can affect the service delivery, healthcare financing, and the various components of health systems in Nigeria. So for me, in your current role, how do you see the place for advocacy and strategic communication as it affects health misinformation?
Yeah, so good. So I think one of the things I've learned in this role, especially and in the work that we do, for us in the Gates Foundation, we believe that all lives have equal value. And one of the things that we try to enforce is making sure that women have healthier lives and children, and especially under 5, get to live. So when we look at that, one of the things we think about is who do we work with? So the first thing we try to do from a strategic point of view is to think, how do we work effectively with governments? How do we make sure that we're working according to the national priorities or even the state priorities? So we don't lead, we are a thought partner and we just work with them in the process. And so as a strategic partner, one of the things we'll try to do is to think about how do we make sure that when it comes to, for example, rolling out new innovations or solutions, that there's some embedding, we try to embed some things in there that could also address misinformation. So in other words, you kind of have to think ahead before you sort of push out the message, because people will ask questions, and one of the big things you have to do is answer the question, why? Why should people do this? Why should people do that? Especially in the era that we live in. And I think the other part too is that one of the things we'll try to do is think about who are the key stakeholders that we can engage with, because the messenger is more important than the message. So the faith-based leaders, those in the community who are quite influential, key stakeholders in government, commissioners. So there are key people that indeed, once people hear their voices, those are people that we would work with to say, you know what, let's try and work on this together. So there's some level of co-creation that we have to do when we're working across this landscape. Then the last one I want to just say is that the importance of technology cannot be underestimated, because we're living in an AI age where everything is coming out really, really fast. So you almost have to think ahead, right? So one of the things that we think about is really how do we make sure that we're meeting our health objectives, but at the same time using technology as a tool to also make sure that everyone gets the right message at the right time. And even if the wrong message comes out, what tools can we use to make sure that this comes out at what do you call it, that misinformation is addressed at a really fast rate? So for us, like I said, we will co-create a solution with our government agencies and government stakeholders so that way the message is already out even before the misinformation even hits. I'll stop there.
Thank you so much, Ekenem, for that. From your conversation, we see that it's critical to ensure that all stakeholders are on board. And so this takes me right to the doorstep of Ms. Adebakin to find out that we have always alluded that the private sector is a key stakeholder in delivering quality and affordable health outcomes in Nigeria, and also ensuring that people have access to the health they need when they need it in the quantity that they need it. So what role do you see critical for the private sector, healthcare providers, and businesses to ensure that Nigerians receive accurate, reliable health information at their first access of points to care?
Thank you very much, Dr. Anne. I hope you can hear me clearly.
Absolutely.
I think we can do much more to involve the private sector. And if you do a quick scan of the private sector we're talking about, you would find that on many platforms where we talk about primary healthcare and information about healthcare, we eliminate some very critical parties like pharmacies and patent medicine stores. Most of the concentration now has been with clinics and hospitals. I think one of the major steps we need to do is do a more holistic engagement. People trust pharmacies and patent medicine stores across Nigeria and in many other countries. So I think the first thing we need to do is when we have campaigns, when we have programs, we need to be more holistic in our engagement of the parties that people trust. I can mention people trust faith leaders, traditional leaders. Yes, I agree. But have you done a check recently of who people go to first line for care? They go to the pharmacy or the patent medicine store. So I think that's a very strong angle that we haven't quite engaged sufficiently. Another is to find influencers amongst these people who are currently speaking on social media. We have some who have taken stock in areas like skincare. You would be shocked at the amount of people now who use triple content creams for their children. They want their skin to pop right from little, under one, and it's damaging their liver, it's damaging their kidneys. We need to begin to engage more of these people who are on the front line, seeing men and women buying skincare programs and skincare products, buying things that are meant for pain and using it to increase their weight. We call it mau. That's prednisolone. They're buying steroids and misusing them. We must engage them. I have seen so many parties speak about primary healthcare and eliminate pharmacies and patent medicine stores. So there's so much more work to be done in engaging all of the parties that are necessary to speak.
Thank you for laying that foundation in addition to how ECANEM has brought us. But building very quickly on that, I would like to find out what are the few things that the private sector can do in ensuring responsible use of social media? We have seen the role of the influencers, like you have said, where people pick up medications that otherwise have more long-lasting harmful effects in the lives of their children, their relatives, and their loved ones with very limited information. We've also seen the role of the media in promoting some practices that ordinarily we would not be promoting and discouraging a few that we should be encouraging in terms of improving our access to healthcare and improving the uptake of healthcare. What can private sector responsibly, an organization like yours, do to ensure that people have the access to only the correct information from these media influences and all the other critical aspects of soft social media that we see?
I think the first thing, I'll mention three. The first is the self-policing or self-regulating perspective. We must begin to speak up and know that we have charlatans amongst us and we can name and shame. That is one. The second is that we ourselves need to be aware of consumer buying behavior and use that awareness to populate that which we're putting out there. We must come down from some high tower and come down to the base level, to people's levels and perspectives. Too many times we speak about health with jargons that people can't relate to. We need to begin to speak the street language ourselves, engage those who are doing it and collaborate with them. That way, when they are saying things, they have in one way or the other, taken advantage of the gates we have opened for them to consult with us. On many platforms, especially now that we've got music, drama, and so many things, gaining traction, we should plug ourselves in there. We should be consultants to Nollywood. We should be involved in the music. When music is propagating use of hard drugs as though it does not have a deleterious effect on people, we should speak up because we feel the impact of the addiction and the impact of these people when they now need to come out of hard drugs. We must speak up about social norms that are now gaining traction that ought not to. You should find when you are seeing the ratings and the credits being given at the end of a movie, you should find our health consultant listed there, 2, 3 health consultants. We must begin to play a key role in media, because media has mainstreamed a lot of notions. We must stay there to correct those notions or to give them input. And then the third thing I believe is that we must begin to reward those that are doing well, publicly support them, and that way we can have a proliferation of good behavior rather than be silent when they are doing well. Those are the thoughts that come
Thank
to mind.
you. Thank you so much for those points that you have raised, especially around self-policing, self-regulation, and insisting on that people be held accountable for the content that they put out, and ensuring that we can replace the wrong information with the right information. Because where there is a vacuum, people have the leverage or the opportunity to fill in with whatever they can, the blank spaces, so that they can continue, the society can continue to move forward. And this brings me to Mr. Onibinde, who is the co-founder and the chief executive officer of Budget. Budget is known to have a robust framework for accountability on several fronts, not just at the national level, but at the sub-national and in the most remote, of places. And Mrs. Adibakin has led the foundation around self-policing and self-regulation. What can an organization like Budget do in terms of ensuring better accountability for the content that's out there through social media, the soft cell media, and all other forms of information that provide a bandwidth for continued misinformation, for health information? Thank you.
Thank you, Dr. Han. And I think I will lay on what Mr. Kenem Misiche and Mrs. Abimbola Adebakin has said. We are in a race against time. The problem with misinformation is that the speed at which it travels, and also or sometimes some of the platforms where these things are published, if we are not careful, we don't have a hold of them. I mean, we all have people who forward ridiculous or ludicrous things to us, just to affirm their biases. Just yesterday, someone in my family member, I appreciate the eldest person in my family, sent a big name politician in Nigeria has 12.9 billion naira sitting in a JP Morgan account. And I'm like, $12.9 billion sitting in a JP Morgan account. That was like, wow, how are you sure of this? And it's just because there's a bias already. Let's not lie. There's an existing bias that people are looking for information to affirm. And so we must first understand the existing bias that also prevails in the space. People have bias maybe to be more light-skinned. People have more bias maybe to have their bum maybe bigger. People have bias to look much more good because of the way media has caricatured or media has postured these things. So in some sort of way, these biases are already existing within the society, and everyone is finding the information to able to affirm these biases or confirm these biases. And the speed at which those informations get out is the challenge that we primarily face. How do we build frameworks so that we can significantly and quickly counter this misinformation? And I always say, I would say compartmentalize the people we're trying to engage. There's a class of people that there's little we can do to change their minds around these biases. So we have to understand that. But there is a middle, there's a sizable middle that exactly is being influenced into this kind of narrative. For some of those people who are stuck in those mindsets, it might be a business imperative for them. Maybe it's an opportunity for them to make a lot of money. Some of them is just maybe of the stories that have been told over the years, and they just talk about that. Even when you tell them that this is not properly right to fix or to treat children or to change children. I mean, people would take children maybe in the mind, they start flogging children on the floor, saying that it makes them much more stronger, and people say it could cause brain damage. Even if you say, no, that's how we've been doing it in centuries and in years before. So what we need to do is also, how do we rapidly respond to these issues, and also understand how we we spread ourselves through platforms as much as possible. And this is where even we can have the sword, and we also have, I mean, AI is where I'm going to, and how much AI can also help us in this, because AI is also a huge tool for misinformation. It can be a huge tool for misinformation, but sometimes when someone says something, we can easily build channels where we can plug this conversation to and rapidly find ways to respond to that as quick as possible. Like the conversation of someone having 12.9 billion sitting in JP Morgan. I mean, I'm like, how is that even possible? Are you sure about what you're trying to say? So, but most of the time, we have to figure out a way to respond quickly to these issues. Because the reason is that ultimate misinformation can damage lives irreversibly, can also even damage countries, and can also even kill a whole lot of people. And so it's very important that we also are quick enough to respond to this. The second thing is also, how do we also amplify voices? But sometimes if a civil society organization that has even 300, 400,000 followers might say things, but might not get the traction, because that a single influencer would make. Because what I've noticed with this new generation of people is that there's much more respect for individuals, or mirroring individuals than brands. So you could see that in the continuous rise of individual influencers that fix themselves to certain thematic areas. Someone like Aproko Doctor will say, drink water. And people understand that when you see him talking about it, it's about right living or drinking water. People like that also could be who we use to influence and to engage people in a much more, because they see that even though they're influencers, there's a sizable number of people that believe them because of that as their expertise. So as we also be able to invest in brands like Budget, like Nigeria Health Watch, we must also try and carry along people who have built influences in terms of their personal imaging of this is the content or this is the ideas that I put forward. I think those are the things
Thank
that
you.
can help us much more.
Thank you, Mr. Thank you so much, Mr. Onibinde. From what you have said, it seems that trust for individuals supersede institutions and organized information outlets. So is there a way that an organization like Budget can work to improve trust in government, trust in our organized institutions, and trust from credible sources as opposed to people who just say it as they think it or they make it up as they go along?
Yeah, there's a role for all of us. And I think most organizations are still subject matter experts. They are still the ones who have dug through the problem, who have and analyzed the issues. But sometimes their language might be in esoteric or arcane or in complex forms. They might not be able to maybe put it in pidgin. They might not be able to mix it up with play so that it gets much more appealing. It could look extremely boring and might not drag people in. What they need to do is to focus on, much more deeper insight and analysis, where they're able to come up with counterfactuals. Because in some ways, when it also comes about countering misinformation, is also being able to think about what the other side is affirming and being able to counter it even ahead of time. So experience this to be able to analyze the situation and organize the content and being able to now creatively present the content and leave the rest to the creators to be able to engage much more. But in building trust, it's just about us making sure that, one, our voice is consistent, because a whole lot of times when trust gets being eroded is because we say something now and we change this in the other time. Our voices have to be consistent on the issues that matter with us. If Budget is a foundation or focused on accountability and transparency, which means that at every point in time where there's an abuse of accountability, we're very clear-minded about where we stand. And that's something that brands or people who represent brands must be able to mirror as much as possible. The second thing is also to make sure that the content is researched, prepared, analyzed in a way that creative content creators and different people can take it forward. I mean, as Budget now, we're thinking of speaking to someone like Mr. Macaroni. We're talking of someone that engage people like Aproko. So we are creating this universe of this creators universe to be able to advance the things that matter to us. It doesn't have to get full attribution to us. It doesn't matter. But what matters is that more people begin to listen to this these things, vanish to waste. Thank you.
Thank you so much, Mr. Onigbinde. Just to come back to Mr. Isichi, asking, I know that an organization like the Gates Foundation puts out several millions of US dollars on an annual basis to tackle health challenges and other challenges that affect social capital development of the average person. And so, how do we strengthen these programs in such a way that we get more out of the monies that we're putting there, tackling misinformation at its very root, and ensuring that people have better information to improve their health-seeking behavior? I know this is at the heart of what you do, and so it is, how do we strengthen these investments that are being made, particularly working with the private sector and ensuring that we speak to the issues at the roots?
Well, thanks for this question. And I'll answer the question in two ways. I think the first one is that it's just understanding that advocacy opens doors, but communication keeps it going. So it's an ongoing endeavor. It just doesn't stop. I think the second thing is that you constantly have to communicate with data. So I don't know if you know about the NDHS survey. I highly recommend for every Nigerian to look at the NDHS survey. It tells you how good and how bad the health statistics are in your state. So we invest a lot in data to really talk about what is really happening in the state. How is the uptick happening? How are states really doing? And you find out that some states are performing well and some are not performing well at all. The third thing is that, I always ask this question, do you even know your primary healthcare center in your village? Have you been there? Or even where you live, do you know have you been to your primary healthcare center, the one that is closest to you? Because guess what? There are a lot of people that go to those places. They may not afford to go to the big hospitals or the name brand places, but they do go to those primary healthcare centers. So do you know anything about those places? And what are you doing to see how you can, help them in those places? And for us in the foundation, yes, we have a critical role in addressing misinformation. And but before then, our goal is how do we really build resilient health systems? Because if you have a weak health system, misinformation will spread. So what you currently have in some cases in Nigeria is that in some places you have a weak healthcare system. So misinformation spreads much faster in those places. So our goal is how do we begin to build stronger health systems? How do we make sure that people get their polio, vaccination on time? You have cases where people say, I don't want to do polio. I don't want my children to get this vaccination. I will not put an X on the door. So when the healthcare worker comes, they'll see an X on the door. But what they don't know is that those children there have not received their polio, vaccination. And so then you now start finding out statistics like, Nigeria has maybe some variants of polio coming out. It's because of the fact that even sometimes that's the reason why we talked about working with faith-based leaders, community health workers, to see how we can begin to drive some of this messaging. And the other thing too is I'll give you a really quick story. My mother-in-law, for example, I didn't want to put her name out there, but a lot of people come to markets, a lot of health products to her from everywhere, China, this is that, and a lot of these things are unregulated. So I have to sit down with her and tell her, a lot of these things are unregulated. You can't use it because you just see it on social media. So to what Mr. Abimbola said, it's a massive industry, but it's also filled with a lot of fake information. And that's why it's what Shimon was talking about. We rather work with a Proco doctor and a few others talking about the importance of drinking water, just as simple as drinking water. There are heat waves coming out. This is what you should do. Don't take, because some people might say, the heat is coming, take this special product that will protect you from the heat. No, just drink basic water. It's as simple as that. So our goal is to really think about, I'm just running up now, think about basically the fact that we have to work with our grassroots and community-based workers. We have to work with the midwives in the community. We have to make sure that local messaging is there in different languages, not just in English. We have to understand that we can't tailor our messaging to it's not a one-size-fits-all. Everyone is different. There are over 250 cultures in Nigeria, over 250 languages. We have to address each and every one of them with compelling messages, through entertainment, through what they call it, radio channels, through different platforms. Well, let me stop there. Thank you.
Thank you so much, Kenem, for your contributions. Advocacy opens doors, but communication keeps it going. So coming to Ms. Adebakin, as we begin to wrap up, it's important, that we move very quickly in terms of using data to communicate health information. How does the private sector present this data in such a way that the average man on the streets can relate with it? A lot of the times when we put out the statistics there, it takes a very scientific mind to unpack it. And that's why it seems like the other camp is ahead in this game. So what's the role? Like very quickly, what are the low-hanging fruits that the private sector can quickly plug to show that we can be ahead of this game and address, making health data simplified enough for the average man on the streets to use?
Thanks, Dr. Ann. One of the things we are doing, and I can speak to what we're doing and maybe a few others, is that we're trying to gamify medication information. Actually put it out there like a game that you play every day once you download the app. We have already built the AI database using different databases that are in paper form. Now you can match and tag, and it's an open source platform. So we built it, anybody can take it and use it. Would love to collaborate with more private parties to be able to gamify that information, because people love games. People love to win lotteries. We must speak the way people want to be spoken to. We should also do the kind of thing that budget did for us understanding high, big numbers, how they broke it down into images, pictures that we could relate with. And now that's what we look out for whenever the budget is discussed. We need to collaborate as well. If there are grants you can give to support those who are beginning to create content that are in maybe pidgin English, or create content around abuse of drugs, please give those grants to support them, because that way they can sustain their drive. I think the private sector, working with bodies like like PSHAN, Healthcare Federation of Nigeria, all of the various associations, can actually form a body to self-regulate and put out standards. I am part of a group called the Health Hub. And we put out standards at a time for doctors who wanted to engage on social media, because it was part of us self-regulating. We thought it was not nice for us to put out content that shamed, that made people guilty or people afraid. And that way we can attract more users than repel them. Because all of the misinformation wants to cause panic, wants to cause misinformation, shame, wants to cause guilt, so that you go and divert your attention elsewhere and they can thrive. I think those are some examples.
Thank you so much, Mr. Adebakin. And to wrap up, I would come to Mr. Onigbinde. I think one thing that has resonated across all our panelists today is the need for greater collaboration amongst the various stakeholders to address misinformation holistically. And Mr. Onigbinde, you are an expert at ensuring multi-sectoral collaboration. What are the quick wins around multi-sectoral collaboration, such that we're all looking at the same thing, speaking to the same thing, and staying ahead of the game?
Thank you so much. And I think first thing is the singularity of data, or even singularity of content. We must be able to agree about the data set or the content that we need to counter misinformation. And that is something that we cannot just attribute to one organization. It must be something that we must co-create and co-develop and co-manage and even co-share. I think that is the fundamental element, because most people who are also on the other side of misinformation, they gladly distribute their content. Even they don't even care about attribution or even copyright and all of that stuff. So it's extremely important that we also do our best best to collaborate on that. The second thing also is distribution. How do we collaborate? Even we work on developing the data or the content together, how do we use our different frameworks to distribute? Some organizations might be strong on Twitter, might be strong on Instagram, might be strong on local grassroots engagement. How do we analyze our strength in terms of content platforms? How do we also make sure that we are sharing this information at scale in that way? Misinformation is like is also creating like a war room in some sort of way where we're able to quickly get the information, understand it, and move as fast as possible. And I think the third thing also is to be able to let there be punitive actions in some sort of way. If you find people who are doing things that is egregiously bad, and that can have significant impact on harmful, on harm, or create a lot of harm to people, we should report them to authorities. They should be held responsible for their actions. They should be deterred and also more circumspect in their future dealings. So as much as possible, we want to counter misinformation by going all out against them in terms of information and content and data and distribution. There must also be responsibility on the part of those that share content where they do not have expertise or do not have the capacity to do so. Yeah.
Thank you so much, Mr. Onigbinde. You have summed it up nicely in terms of people need to be held accountable for the content they put out there. It's also important that we need to co-create, to co-share, to co-own information and help to manage medical misinformation or health misinformation so that people can have access to only information that is correct and consistent. So I would like to thank you all for your summation. And then I've looked in the chat box, we do not seem to have any Q&As from members of the audience, but just in case anyone has a question, please, you have a minute to put it in the Q&A box and then we can quickly, okay, I see a question. Okay, it's a comment here. I think Bimbo has actually nailed it. We need some form of regulation in the content going out there, like seasonal. So this is more like a comment. And I see Shemilore Adeoluwa. Please, could you put your question in the chat, in the Q&A box so that we can pass it on to the panelists who you would like to answer that question. Shemilore Adeoluwa. Okay. Dr. Tinuola.
So while we're waiting for questions, I felt it would be helpful if one of the panelists could tell us as individuals, what can we as individuals do to counter health misinformation? Thank you.
Who wants to take a shot at that? We'll start from Ekenem.
I thought you were going to do ladies first, but that's fine. So
After
I think
the men.
no worries. So I think the first thing is that each of us has a platform and we have a voice, you know, and communication is constant. It's not a one-time thing. It's not after one event or one big thing. You have to keep, what do you call it, and reinforcing the messaging consistently. So I think through our different platforms, whether you're on social media or you're on WhatsApp or you're speaking in your communities, you know, try and be a bit more intentional about spreading that information, especially around what do you call it, especially around different things that you know that can really help people in the communities. I'll give you a good example. 2 weeks ago, someone came to me and talked about the fact that there was a lady who had it. They took the pregnant lady went to a primary healthcare facility in a particular state, and they didn't have any money. They didn't have, so they went there thinking that they would get free healthcare and free services in that particular area, but they didn't get that, and the baby ended up passing away. But this is the reason why we're telling folks to begin to invest more in their primary healthcare facilities. The facility said that they didn't have any commodities, that they were stock outs. And so when the lady arrived there, there were no, what do you call it, essential commodities. And number two, the person who was actually taking care of her wasn't a healthcare worker. It was actually an environmental worker who had been, what do you call it, helping to deliver babies. But you can imagine if there are complications, that person wouldn't know what to do. So I think let's be a bit more intentional. Go down to your local PHC, see what's happening, you know, go beyond the outreaches, go to a particular facility, see what's happening, see how you can help them do that. We did that a year ago. I actually did that in somewhere between the border of Lagos and Ogun State. I'm neither from Lagos, now I'm from Ogun State. But there was a need in that particular community, and the whole idea was, let's go there, let's see how we can scale that facility up because of the volume of people that are actually going there. And we did that. So we all have voices, we all have platforms. Let's utilize what we currently have and let's save lives together. Over.
Thank you, Mr. Isiche, for your comments.
Yeah.
We all have voices, we all have a space, and let's utilize our spaces. So I will come back to the other panelists to talk about what we can do as individuals in your 1 minute wrap up. But we have a few questions from the distinguished guests online. And so Delio Gundanusi from Health Nika says the major challenge is reaching the majority of Nigerians in rural and semi-urban communities. Mr. Onibinde, how can messaging be taken to majority of the Nigerians in rural and semi-urban communities?
Thank you so much. We have to meet them where they are. And one, radio is important. And even if you listen, community radio is extremely, because there are also personalities that mirror those things. For example, I shuttled around Ibadan a lot, and I know there's Oriyomi Amzat, is a cult figure hero in Ibadan. He's a cult-like hero in Ibadan. So someone like that will be extremely important, and maybe get a segment on his program, speak on these issues periodically. And you have people like that in different spaces that we might not even know in this our Chopford life and busy life. So a lot of people, radio also is extremely important, especially frontline leaders in radio across radio platforms. The other thing is also to pay attention to certain platforms. I mean, my mom is my small test in terms of you understanding what happens maybe the grassroots, and I'm always fascinated about how much platforms like TikTok, how significant TikTok is. It's even for people of in those environments. You might think they don't, but somehow they are fascinated by it. You also even look at Opera News. I was shocked at the scale of believability that people have of Opera News and how much whatever goes in there. And a lot of times when I read some of the things at home, I feel like this is junk news. This is not true as much as possible. So we must do a proper diagnosis of the channels and the platforms that are being used.
All right. Thank you so much, Mr. Onibinde. I have quite a number of questions running in here in the chat box. So we'll try to get through as many of them as we can. For those that were not able to answer during this webinar, I'll ask that you continue to engage with us via our various social media handles, where the experts online here will answer those questions, and you will be able to get answers to your questions. So for Anyeka and Joseph, you said you'd like to get the opinion of Ms. Adebakin on what regulators and institutional players can and should do to regain credibility and public trust. Over to you, Ms. Adebakin, if we can just do this in 30 seconds.
So trust is built over time. Trust is built with repeat action and consistency. One of the things we're seeing now, in fact, I helped to facilitate a consultant dermatologist, to link her with the Pharmaceutical Society of Nigeria. And next thing I saw is they roped in NAFDAC and had a whole webinar on skin treatment. That is the kind of thing we need escalated maybe to 1,000 times. These institutions have their own internal experts. They need to come out and speak with those who are influencing outside. We also need to create a health information system that I don't know how it will be funded, but we are constantly turning our content and giving to them. The part of your social responsibility is to take content like this and share. If they will be paid or unpaid, I don't know, but we need to create that and link up with them in a proactive manner. We can't just stay isolated and insulated. We must step out and work with them.
Thank you so much, Ms. Adebakin. I will come to Mr. Onigbindi now and ask from David Lawal, do you recommend sanctions for social media users and bloggers to address misinformation?
Of course.
Just in 30 seconds.
Yes, I agree that there should be sanctions, but there also should be warnings. So maybe we should not just throw people straight to jail, but if people are serially committing these offenses, there should be high sanctions. So maybe the first time you tell them to apologize, the second time you tell them with strong sanction to apologize, maybe with a fine, and the third time, if somebody perpetually indulges in things like that, they should be able to face justice at the highest level. Thank you.
Okay, thank you so much, Mr. Nibinde. And Ekanem, just also to find out from you, do you know how members of the public can decipher credible sources of health information on social media, especially seeing as a lot of people have put their trust in some of these influencers? So do you, can you advise on how the public can decipher what sources of information are credible and which ones are not?
No, thank you for that question. The messenger is more important than the message. So who that individual that is sharing that message, one of the things you always have to look at is this a credible source? And number two is, has this been verified? And verification is not just from one source. You're going to have to find a different source to make sure it's actually credible. Like Sharon said, if I see something on Pera, I just don't take it at face value. I have to go and check other sources to make sure that this is the right thing. If you get something on WhatsApp, ask more questions, verify. Even NAFDAC as a regulator issues out things around things that maybe if there are drugs that are being recalled, things that are being, what do you call it, things that, what do you call it, are fake. They typically talk about that. Another thing too is also going to your local pharmacy to also find out, is this thing actually true or not? Does this drug really help or not? I ask those questions. If I go to a pharmacy, I ask a lot of questions. My mother was a pharmacist, so I was trained to understand that there are good drugs and there are bad drugs.
All right. So
Yeah.
Thank you so much. We have quite a number of questions that have come in, but I will crave the indulgence of the members of the audience to please engage with us on our social media handles, and these questions will be answered. The social media handles will be posted on the link to the chat so that you can hop on them and then get answers to your questions. I will then give our distinguished panel of experts 30 seconds, just 30 seconds for your closing remarks. So I'll start with Ms. Adebakin.
We need more of this. This is very short, very sharp. I love it, but we need more of such sessions. Let's bring more parties that can influence. Next one, I hope to see Apoko, Dr. Zobo, and so many others, Farm Radio, on a panel like this to just help them, modify what they're saying.
Thank you so much, Ms. Adebakin. Mr. Isichi.
So my closing remarks are that a healthy, informed Nigeria can only happen one conversation at a time. Let's keep it going. Thank you.
Thank you so much, Mr. Isichi. And Mr. Onibinde.
Fighting misinformation is a collaborative effort. So we need to work together to strengthen the data ecosystems and the distribution networks. And we have to do this with speed and the agility required. Thank you.
Thank you so much, Mr. Onibinde, and thank you so much, our distinguished panel and everyone who has been part of this conversation. I'll bring on Mr. Muyiwa Olowokoroko, who is the head of memberships and partnerships for Private Sector Health Alliance of Nigeria, for his closing remarks. And thank you all for being here.
So I think Muyiwa has dropped off the call. Since I gave the opening remarks, I will give the closing remarks as well. I just want to thank everyone, our expert panel of judges, our moderator, and of course, all the guests that we have here. It's been a great session. I've gotten a lot of information, and I'm sure a lot of our guests have had the same. I thank you all for coming, and I look forward to having our next episode of the PSHAN Periscope. Wishing you all a wonderful day. Thank you.
Thank you. Thank you very much.
Thank you very much.
Thank you, everyone.
Let's keep
Thank
the
you very much.
applauses coming. Thank you.
So much. Thanks a lot.